Good morning, happy Monday, everyone. Hope you're all doing okay. Kathleen, I love your question and I wanted to reply to it, and it was going to take forever, so I've just done a quick video. Apologies, but you asked, you'd like to know from surgeons, what are the red flags clients should look for at their consultation so this level of aftercare never happens to them? And it's just responding to an appalling level of aftercare, I think, in a post that was put forward with a lady who had poor breast surgery and couldn't get in touch with her surgeon afterwards. And this question is dear to my heart. I was invited to speak to a firm of solicitors for their in-house training, and one of the topics I covered was what are the red flags for them for being able early on to screen out cases with a poor chance of success and to screen in cases with a high chance of success. Now, you can use exactly the same list for you. What are the things that you should know to screen out surgeons or institutions that you shouldn't want to be with? It was a 10-point checklist in my case, but the ones that you can know before the surgery has happened itself amounts to 7. So here they are. Red flag. I'm just looking at my actual presentation now. Red flag number 1. First of all, I'm sorry, overseas surgery or a fly-in, fly-out surgeon. If they're a fly-in, fly-out surgeon, you're not going to have access to them because they're going to spend the other couple of weeks a month in other countries or one other country. Similarly, if they're an overseas surgeon, you're going to be in the other country and you're still not going to have access to the surgeon. So just don't do it. It's the biggest number of cases are with fly-in, fly-out surgeons or overseas surgery. Number two, a single preoperative consultation and a short consultation and no cooling off period. You are entitled to 2 consultations, a 2-week cooling off period, and that consultation should be long enough to answer everything you need to know. I can't do it in under an hour, so I normally spend, I normally spend 2 45-minute consultations, which usually overrun actually, 2 45-minute consultations with the option to have more, and that's free of charge. So the first consultation is paid for, and you can have as many more preoperative consultations as you need to have all the information. No new information on the day of surgery. So if you are given, and you keep hearing this again and again, I had a single consultation that lasted about 15 minutes or 20 minutes. Run, don't walk. Number 3, delegated care. So if a significant amount of your care is delegated to another person inappropriately, then that is bad. So your preoperative decisions should be made by you and a surgeon, not by you and a salesperson, not by you and a patient care advisor who may or may not have nursing qualifications, not by you and a patient coordinator. You and the surgeon make the decisions. And if a lot of that, what I say is a 45-minute, 1-hour consultation, is spent with a coordinator and then there's rubber stamped in 10 minutes by the surgeon afterwards, then still run. That is no good. These are all things you should think that are making the practice's life more efficient and quicker and cheaper to run, but they don't help you. And you should always think, is this for my benefit or their benefit? And if it's not for your benefit, then it's not right. Number 4, excessive preoperative reassurance. Okay, so I talk to my responsible colleagues and we are always going to great length to actually paint the worst case scenario, and you've still got to agree to that. Well, this could happen. Yeah, but it's not going to happen, the patient may say. No, it really, it might. It could, and if it does, you've got to deal with it and you've got to be okay with it. But you seem to see the opposite in the cases that end up being litigated. I thought such and such was a problem, but I was reassured that it wouldn't be. Or in this case, I was worried that the 450cc implants would be incompatible with my body, but I was reassured that they would be fine. Actually, if you find yourself being excessively reassured, if it sounds too good to be true, at least get other opinions. It may be appropriate reassurance, but it may not be. Get other opinions. No harm in getting other opinions. You can often, in some way, get a free other opinion, so it doesn't need to cost the earth. Forums like this are great for that. People do free mini consultations from time to time, myself included. Many surgeons do, so you can usually get a free second opinion somehow. Red flag number 5, massive checklists. So massive checklists of complications. It's a sort of this, tick, 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 tick during your consultation. Well, that is in lieu of a proper discussion. So if it is there to prompt, to make sure that nothing is missed out, great. If it is there to document that a conversation has been had, great. But if the only aspect of that consultation is, I am now about to tick this piece of paper, then you haven't had an explanation. But they have just documented that you have. So if you see excessive checklists, and especially on the day of surgery, terms you've never heard of before, then this is a red flag. In fact, in that paper, in that presentation, it was quite funny because there was one surgeon who had gone through the checklist so fast, he had checked risks of capsular contracture, risk of implant rotation, risk of implant rupture. The problem was the patient wasn't having breast augmentation, she was having a breast reduction. That's how fast, that's how little thought can be going between pen and hand, and it just really indicates how valid that in itself is not. Okay, so I hope that answers your question. There are more points, but many of them are now after the event, which will be no good to you because hopefully you will have screened yourself out before that happens. All right, take care. Hope that helps. Bye.